Hi, my name is Desiree Morgan, and I'm a governor of the American Board of Radiology. And I'm here today to talk to you about the new DR oral certifying exam. Now, we understand at the ABR that candidates and faculty alike are stressed about a major change in a really important exam. We get it. We put a lot of thought and effort into how we're making these changes. And we hope that with periodic updates, we can help alleviate some of the uncertainty to reduce your stress about the exam. Before we talk about the new exam, let's just go back to the old exam and talk about how it happened. It was administered in person in Louisville, Kentucky, where candidates would pass from one room to another being tested in 10 categories of diagnostic radiology. You can see them listed here. Those testing periods lasted 25 minutes each, and basically the candidate would rotate from one room to the next until all were covered. Now, there was a standardization of that test in that the cases, the 15 or so cases for each exam in the morning or the afternoon were set, but there was not a set way in which the examiners used them to assess the candidates. Now, the new DR oral certifying exam will take place starting in 2028, and the people affected by it are our new R1 candidates. So those diagnostic radiology residents that are graduating in 2027 will take this new oral certifying exam. It is a remote exam. So you might or might not know that other areas of the ABR, the other disciplines, have been examined with oral tests for the past decade. So all radiation oncologists, medical physicists, and interventional radiologists have been undergoing oral exams. And they were converted during the time of the pandemic from in-person to a virtually or remotely administered exam based on a video conferencing system that the IT section of the ABR developed. So we've been doing those exams successfully, and we're confident that we can carry this out for diagnostic radiology. We've got a few things to work out between now and 2028. And as we learn them, we will be sharing them with you. So it's a remotely administered exam with 7 categories: abdomen, breast, chest, MSK, neuroradiology, nuclear radiology, and pediatric radiology. Each of those areas will be tested in 25-minute intervals with 10 minutes to transition between one remote or digital exam to the next. Now, as opposed to the old oral exam, there will be standardized testing and scoring format to reduce subjectivity. You'll notice that abdomen is going to be comprised of the prior GI, GU, and ultrasound sections. And I want to make a point here that ultrasound will be tested in abdomen, but it will also be tested across each of the domains where it's important for taking care of patients, like MSK, breast, etc. More details include that we know that we can't cover the entire content of a domain in 25 minutes. So yes, it's impossible to test all of abdomen in 25 minutes, all of neuro, MSK, etc. What we hope to do with the new test is to assess a sample of the domain in those 25 minutes by a case discussion. So in other words, we're trying to assess skills that have been difficult to evaluate with a strict computer-based exam, which we've had for the past 10 years. So what are those skills? It's basically what we do as diagnostic radiologists every day when we're taking care of patients. We detect findings on images, we discuss them, we put them into a report, we list a differential diagnosis where it's important, we suggest other imaging or things that need to happen for medical management or surgical management. We also want to be able to assess when candidates are aware of something that's really important, like non-accidental trauma in PEDS cases or new stroke or GI bleeding. And through the case discussion, we hope to evaluate communication skills that are so critical to us performing our clinical daily practice. People have asked, well, what about physics and non-interpretive skills and procedures? They will be incorporated into each of the 7 categories as appropriate to the case discussions. In other words, we might discuss a deep tissue biopsy or paracentesis in the abdominal section, whereas a joint injection for MSK will be in that section, etc. For non-interpretive skills and physics, we'll be talking about professionalism, looking at communication, and physics will mostly be practical applications, so safety issues or how to mitigate artifacts that we're seeing. We'll be talking to those in the context of the cases. There's a whole lot more information that you can get about the new exam, as much as we know about it, on our ABR website. So I've included a few links here. And for those of you that really want to see kind of how it plays out, we have, the ABR has produced a mock-up of an IR oral exam. So you can look at that, get a feel for the video conferencing setup, and try to project that into 2028 when we'll be doing the same thing for diagnostic radiology. Thanks so much for spending your 5 minutes with me to learn more about the test.